In today's Wellness Wednesday, we are joined by representatives from ReGenesis Health Care, a place where healthcare is accessible and designed for everyone. RHC serves Spartanburg, Cherokee, and Union counties with 13 locations. And joining us today, we have got Bethany Ghent and then Whitney Wright, all to talk about something super important, colorectal cancer awareness and prevention. Thank you for being here. We've had some fun conversations kind of off air because while this is a very serious topic, we want to, jump right in. Bethany, why is colorectal cancer awareness and prevention so important, even for people who are like, oh, I'm so healthy, I feel great?
Yes, so colorectal cancer screening is really important because it allows us the opportunity to stay ahead of our health. This is actually one of the few cancers that we can prevent, not just detect early. So most people think that I have to have symptoms to get checked.
Yeah.
But really early changes can happen silently. So even if you feel completely healthy, you still benefit from screening. And screening now is easier and more accessible than ever. You can even complete it from your home. And so it's really just a great way to take that step and get ahead of your health, and it makes a great impact on your colorectal health
Prevention is key
Yes,
for this.
absolutely.
And Whitney, talking a little bit about what are some of the, the signs and symptoms that people should be aware of, and of course, what age should we be thinking about getting that screening?
Well, average risk at 45 years old is when folks should start getting screened. If there is a familial or a genetic history, screening should even start earlier than that, and that is also why it's very important for us to have primary care providers. When I turned about 35, I was like, I should probably have a primary care provider and stop just going to urgent care.
You think you're invincible at a certain age, but you're like, oh, nothing matters to me, I'll deal with it later. But this is something you definitely want to catch early and make sure. Are there some things that maybe if you're going on in your body that some warning signs that you may say, oh, maybe even though I may have already had it done, or you kind of anticipating it before the age of 45, are there some things you should be looking at inside your body? Like,
absolutely.
Absolutely. So things like unexplained weight loss or unexplained fatigue. Maybe you just feel super tired and you're not sure why, or you've had a great amount of weight loss. Something else is blood. Actually, when you're going to the restroom, if you have blood, you definitely need to get that checked out. Abdominal pain. Those are just some of the warning signs that maybe I should have something checked or speak with my doctor about that.
And is there anything that we're doing like in our everyday life that is either causing this or that could be prevention, like things that we eat or lack of activity?
Absolutely. So things like what we eat and drink can play a big role in supporting and protecting our colorectal health. So eating fruits and vegetables, whole grains can really support that digestive system to make sure that it functions well. Leading an active lifestyle, staying well hydrated also supports a healthy gut. So, let's say you're looking for a place to start for exercise. The weather's getting warmer outside. The American Heart Association recommends walking 30 minutes per day, 5 days per week to optimize cardiovascular health. So consistency is really key. Making small daily choices like walking and eating healthy can really make an impact on your colorectal and just in general health. So.
Okay. I want to go back to the screenings real quick, because this is what we were talking about. We all know, like, Wayne's like, okay, it's colonoscopy day. Like, you got to do what people drink because they hate drinking the drink beforehand. And then there's another option, like the Cologuard.
Yes.
So let's talk about that, and maybe people that are nervous about actually going through with what you have to go through with.
Well, and that is the great thing about colorectal cancer screening is that you as a patient do have several options. We offer fit test envelopes at ReGenesis Health Care. That is probably the most simple option that one could pursue. There in the middle, a little bit more comprehensive, is the Exact Sciences Cologuard kit, which both of those tests can be completed at home, like you mentioned. A lot more people are comfortable with that. But the gold standard that we do recommend is a colonoscopy. And the great thing about that is, besides the fact that you will be put to sleep, if the results are negative, you don't have to be screened typically for about 10 more years.
Oh,
so it is, yes,
so
it is imagery.
Drink, and deal with that for one day, no one.
And I've heard the prep isn't as bad as it used to be anymore.
Okay.
It is said to be more like Gatorade now.
Okay.
So if someone can stand to drink what they need to and not eat like they're not supposed to, then the colonoscopy really is the greatest level of imagery that they can use to detect.
Because I had a friend that had it, and she was at a concert that night. Afterwards, over, I was like, I thought you were going to be like out for the game. It's like, no, it was easy breezy. So
outpatient.
So don't be nervous. Don't let this, deter you from anything. We appreciate y'all's tips every Wednesday so much. ReGenesis Health, they are fantastic. All the information on their screen.
Yep, myrhc.org is the place to go and check out. Thank you guys so much.
Thank you.
Of course.